How does brain mapping pinpoint seizure origin for epilepsy surgery? Imagine trying to find a tiny needle in a big haystack. That's similar to locating the exact spot in the brain where seizures start. Brain mapping is a crucial tool that helps doctors do just that. It's a step-by-step process that combines different techniques to find the seizure focus with high precision. The goal is to identify the specific brain area responsible for seizures so that surgeons can remove or treat it while protecting important brain functions like speech, movement, and sensation. The process begins with analyzing the symptoms and behaviors during seizures, called seizure semiology. This gives doctors clues about which part of the brain might be involved. Next, they use non-invasive methods to gather more information. Scalp electroencephalograms record electrical signals from the brain surface, detecting abnormal activity linked to seizures. Advanced imaging techniques like magnetic resonance imaging show detailed pictures of brain structures, helping spot abnormalities. Functional scans like positron emission tomography and single photon emission computed tomography reveal metabolic or blood flow changes that can point to seizure areas. Magnetoencephalography, which detects magnetic fields produced by brain activity, can also add valuable localization data. All this information is then integrated by neurologists to refine the suspected seizure focus. When non-invasive methods don't provide enough clarity, doctors turn to invasive techniques. They implant electrodes directly into or on the brain surface, often using stereoelectroencephalography, or SEEG. These electrodes record electrical activity over several days, providing detailed, real-time data on where seizures originate. Robotic assistance can help place these electrodes more accurately and with less discomfort. Because some brain regions are responsible for critical functions like speech or movement, functional brain mapping is performed during the process. Electrical stimulation is used to identify and preserve these eloquent areas. This can be done while the patient is awake or with electrodes in place, ensuring that the surgery removes the seizure-causing tissue without impairing essential abilities. Once all this data is collected, the surgical team uses the maps to plan the procedure carefully. The aim is to remove the smallest amount of brain tissue necessary to stop seizures, often using minimally invasive techniques like laser ablation. This personalized approach increases the chances of seizure freedom while reducing the risk of neurological deficits. In the end, brain mapping is a complex, multidisciplinary process that combines clinical observation, non-invasive scans, invasive recordings, and functional testing. It helps doctors pinpoint the seizure origin with remarkable accuracy, guiding personalized treatment plans that improve outcomes and preserve quality of life. If you or someone you know is considering epilepsy surgery, it's important to discuss these options with a specialized medical team to understand the best approach for individual needs.